Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, everyone. This is Doug Nelson, and welcome to another episode of Research Perch from the Massage Therapy Foundation. On today's call, I have three guests from Blessing Hospital in Quincy, Illinois. And my guests are Laura Bliven-Leapley, Karen Kerns, and Cynthia Spake. And again, they are from Blessing Hospital in Quincy, Illinois. Blessing Hospital is a 307-bed acute care hospital in West Central Illinois. It's a non-for-profit, community-based provider founded in 1875. Blessing offers the most comprehensive healthcare services in about a 100-mile radius, meeting the needs of people from West Central Illinois, Northeast Missouri, and Southeast Iowa. And Blessing employs about 2,400 people and is a member of the Blessing Health System. So to my three guests this morning, welcome so much. Karen, could we start with you? Would you introduce yourself to everyone?
Sure. Thank you, Doug. I'm Karen Kerns. I'm the Assistant Director of Rehab here at Blessing Hospital. I oversee the physical therapist, the occupational therapist, the speech language pathologist, the RNs and CNAs in our inpatient unit. And just recently, about 2 years ago, I started overseeing the massage therapy program from the beginning of the program. I am a speech pathologist by background, and I have been at Blessing here now right at 11 years and been in healthcare in the therapy realm for around 27.
Wonderful. Thank you so much. And Laura?
My name is Laura Bliven-Leapley. I am the Director of Medical Surgical Services and Specialty Care here at the hospital. I've been here for 18 years. I am a registered nurse by background. I am very fortunate to be able to be involved in not only the inpatient side of our hospital, but also on our post-acute side of our hospital as well. I oversee our soon-to-be 41-bed medical surgical floor that'll be primarily surgery. I also oversee our 5th floor, which will be observation medicine, and then our COVID unit. And I work in conjunction, and I'm very fortunate to work with Karen with our rehab department, which is an 18-bed CARF-accredited program and department. I also have oversight of a 20-bed inpatient skilled nursing unit, which we're licensed as a long-term care facility. I am the facilitator for dialysis with DaVita. I also teach clinicals for one of our local universities, and have been part of our integrative care program from its inception in 2017.
I mean, that's it? That's all? Jeez. And what in your spare time? Okay. All right. And Cindy?
Yes. Good morning. I'm Cynthia Spake. I'm one of 5 massage therapists here at Blessing Hospital. I've been with the program from the beginning. I am a 31-year veteran of massage therapy in the Quincy community.
Thank you so much. Great. And obviously we're here to talk about the massage therapy program. So what I'm curious about the inception of the program, if I'm understanding it, this started 2 years ago, is that correct? And so I guess I'm curious as to what the genesis of this program was and how that began. So who would like to take that?
Karen, do you want me to start with integrative care?
Yes.
Okay. Integrative care was something that was brought to us as a hospital by one of our cardiologists, Dr. Irv Schwartz. Very much involved in holistic medicine, had a passion for it. He started several programs within our health system to help support holistic medicine. Out of that came a committee called our Integrative Care Committee, which, you know, for a Midwestern hospital was somewhat unique because, you know, it's very, I would say, outside of the box thinking for our community. And we were very lucky to have a provider bring it forward, because we knew that if we had provider input to move the program forward, it would move at a much more rapid pace. So we actually brought a team together and started looking at opportunities in terms of how we could use integrative care to impact overall pain management scores for our inpatient HCAHPS patients that we were surveying at that time. 2017, it seems like a lifetime ago, but ultimately it was just 3 short years ago. And what we've been able to accomplish just from the inception of our first meeting, which was in January of 2017, we've moved somewhat away from committee work and has really focused on what we have seen to be the biggest benefit out of that committee, which was massage. And part of that work with pain management and trying to determine how we could think differently about impacting pain scores. Some of the things that we came up with were essential oil use, distractionary methods such as iPads with white noise, Sudoku books, coloring books, anything that you could provide to a patient to help distract them a little bit more, to get them to focus a little bit less potentially on the pain that they were experiencing. Some of those things, as I said, we worked very hard to hardwire into our culture, and some stuck, some didn't. Essential oils was one of those things that, I think was starting to take off within our organization. We had actually, with the help of one of our nursing programs not one of our nursing programs, our nursing program, we had some senior students who took on a project to develop integrative care kits for each one of our inpatient units. Those kits actually incorporated essential oils, coloring books, colored pencils, description of our massage therapy program, benefits, all of those things. And so it would empower the nursing staff to obtain that kit, take it to the patient and say, okay, here's some options that we can work with, see if we can help get your pain under control. The kits made it okay. Essential oil, I think, was something, like I said, was just on the cusp of taking off. And then we discovered that the Joint Commission had different plans for essential oils. In 2015, 16-ish, the Joint Commission started looking at the utilization of essential oils and finally came out with a statement that if you are going to use essential oils for symptom management of any kind, then in essence, you did need to have pharmacological management of that particular oil because you're utilizing it as a drug, and you need to have provider oversight of administration. And so it really took away from the autonomy that we were giving to the nursing staff to utilize that type of a tool. And so we moved away from that. And, as I said, massage was one of those things that was, quite different in terms of management of overall pain. And I'm not going to take credit for any of that idea from a massage perspective. That ownership solely belongs to our CEO, Maureen Kahn. She had this vision of how do we bring a different type of modality into the facility to help with pain management. In combination with that, we also knew, around that time that there was a significant opioid crisis within the United States. I think we can all attest to the fact that we've heard about states suing Big Pharma and so on and so forth. And so it just meshed well for us to move forward with something different to not only support integrative care, but more importantly, see what kind of effects we could have to reduce the overall usage of opioids within the 4 walls of the hospital. And, Maureen had a vision. And when Maureen has a vision, as Karen will attest to, we move forward with that vision because she's very much a forward thinker. And, you know, the program, we started having conversations about it. What does it look like? Who do we bring on board? You know, do we charge for it? Do we not charge for it? I mean, all of those questions started to be asked. And one of the questions that I was posed is, where is this department housed? Initially, the thought was we were going to house this department within our centralized staffing department, and that we would have the staff of the massage therapy department then go to the different units and support patients. And I said, let's take a step back. I said, we have an entire department of just therapists. And to me, it would make so much more sense for all therapists to be able to be in one department, support each other, because ultimately they function different but yet similar. And so I wanted to ensure that we had a leader over the massage therapist that understood what it was like to be a therapist, because it's just vastly different than being a nurse. And ultimately the decision was made to place massage therapy in Karen's hands, and she's been able to move the program forward, grow the program, and, you know, continue to have, I believe, Cindy can attest to this, very happy employees, very happy patients. And, you know, we're just starting now to, well, we were just starting before COVID. COVID has changed our world. You know, we were starting to look at volumes, how, you know, how many people are ordering massage, what do their pain scores look like? You know, those were things that we were just starting to actually ask questions about. And, you know, COVID has changed the way we do things. And so we really need to get back to the results, the outcome, to ensure that we can show that moving forward. And it'll happen. There's no doubt in my mind. It's just now we're in the process of refocusing and figuring out what that data is going to look like.
What a journey. And as so many times it happens that it's the passion and commitment of, you know, 1-2 people, in this case, the cardiologist and your CEO, to bring this to fruition. So Karen, it felt like sounds like the ball went to your court to actually take it from this idea to implementation. How did that happen?
Yes, that's correct. So as Laura said, she asked me if I would be interested in formulating the massage therapy group and leading that. And I've been very excited and from day one to get this program going. So the first thing that we came across was, how do we get the order to the massage therapist? Because they are a licensed professional, so we need a order in order for them to go see a patient. So they can't just go into a patient's room and see every patient. There's actually a process. It is a nursing-driven order. So the nurse can order for the massage therapist to come in. The physician can order for the massage therapist to come in. So that was part of the foundation, was to get that set up in our electronic medical record. So what occurs currently is the nursing will order it. It will be put in to our electronic medical record. And then the massage therapist, it populates on their work list. They see it on the computer. They know to go see those patients. We initially started with one-day surgery and OB. Those were the areas that we were going to focus on. But very quickly, we found that this was such a phenomenal service we could give to many, many patients that we went pretty much house-wide. Their massage therapists are on our rehab floor, they're on our med surg floor, they're on our oncology floor, they're on our skilled nursing floor. They go everywhere. Currently, they go everywhere other than our psych department, and that has been something that we were looking at prior to COVID. And then we kind of had to put things on halt, like many other areas of the hospital. But we do definitely see that as a potential in the future. So we got the electronic medical record up and running. We did our interviews and we hired our initial staff. We hired a couple full-time, a part-time, and then a couple per diem so that we could have backfill, so that there's not time when somebody called in, you know, or something, we didn't have anybody covering. So we've been able to have somebody here pretty much every day now. Just recently with COVID and some things like that going on, you know, there's been a day or two, but for the most part, we have someone here Monday through Saturday, and seeing these patients. And what we have found from that is wonderful comments from our patients. We do discharge phone calls. And so once the patient leaves the hospital, we have a discharge phone call center, and they will call the patient, you know, did you make it home okay, your equipment? And then one of the questions is, was there somebody you'd like to recognize? And multiple times over the past few years, we have seen massage therapy get recognized. Not always just the therapist, but just the actual massage itself, and how wonderful it is. Absolutely, sometimes people will name the actual therapist and tell how wonderful that particular therapist was. But I do circle back and send those to the massage therapists themselves, because sometimes it's more than one massage therapist. If that patient's here, I'll use rehab as an example because that's the most I'm familiar with. You know, they may be here 3 weeks, and they're getting that, if not every day, maybe every other day, or whatever the massage therapist feels is appropriate. And so they're seeing multiple massage therapists, and we get accolades constantly from our patients about what a wonderful service that is. So we know it's working. We know it's working. It also decreases the pain level. The nurses are very appreciative that they have this as a resource they can go to when that patient does have the pain. Physical therapists also very much appreciate it, because we sometimes push that patient and wake up a muscle that maybe has been dormant for a little bit, and then that patient needs the massage therapy combined with it. And so it has been a very nice juncture with our other therapy program. The other thing I guess I would just say is we have had a couple of staff that have left over the years, and we do what we call peer interviewing. So when somebody applies for the position, we do interview that patient from that potential employee from a leadership standpoint. But then we have our massage therapists come in and meet with them. I'm not a massage therapist by background. There are certain things massage therapists want to know you can do in a medical setting, or be willing to learn in a medical setting. And so we do have our massage therapists very involved in the hiring process, no matter if it's a part-time, full-time, or per diem. They sit in on all those interviews and help us select the best candidates for the job. So that, I think, has also worked well. It's a fabulous team here. I can't even explain how wonderful and very autonomous that they are. If they see something, they bring it to me. This policy isn't maybe working the way we thought it should. They rewrite the policies, and then we talk about making sure that the policy fits the regulations from all of our governing bodies, fits the regulations from Blessing Hospital expectations. And at that point, then it comes to fruition and becomes the actual policy. So we have them very involved in every aspect that we do, because I personally believe they are the experts. They're the ones that have the degree. They're the ones that have the expert opinion. They're the ones doing it day in and day out. So they know the appropriateness of their job, I suppose.
Wow, this is so impressive, and it reflects incredibly well also on Blessing and the culture that you have there, and that, you know, patient-centered approach that you are taking. It's impressive. And Cindy, am I to understand that you were there kind of from the inception of this program? Is that correct?
That's right. And so over 2 years ago, they had an informational luncheon, and several massage therapists who were interested in maybe coming into a clinical setting showed up. And I can't tell you the joy in my heart during that luncheon to hear and talk about the ideas of the program. I knew that it was something very special to bring to the community, to the patients that walk through the doors, sometimes not walk through the doors, a Blessing. And I was ecstatic about it. So that's how that got started. And they did go through that interview process. There were 5 hired. For myself personally, being a massage therapist for 31 years in our community, I still had private practice going. And so I made room in the commitments I had outside of private practice, with on-site massage, things like that, so that I could come to Blessing and be a part of the team. And so it began, and I love the ability to work with many different patients throughout the day. I think it keeps it really fresh. It also challenges myself and my colleagues to be put in circumstances that maybe aren't very comfortable with a patient, and we support one another, especially when there's something really critical going on with a patient, just to give them a heads up that when you walk in the room, this is what you're going to see, you know. And I wish that sometimes somebody would tell me, because it's frightening. You know, I've had to walk laps, and I do get a lot of exercise in my job, so that's a great byproduct, you know, up and down those halls, and it's a pretty big hospital. So I love that mobility that I get throughout the day, and climbing stairs, and sometimes just to shake off that stress of what I had to encounter with a patient throughout the day. So it's a job that is very different from private practice, in that it's more analytical thinking, being able to come into a room very quickly and see where that patient is. And it's not as much about technique as it is about communication, building trust quickly, and being able to put your hands on that patient in a very compassionate and empathetic way.
Wow. Amen to that. Wow. You know, I'm struck by a couple of things. One is, again, the idea of bringing something to fruition. I mean, great ideas are wonderful, but actually making those ideas happen, and especially in an organization and in a setting like this, is no easy thing. And really for all of you to make that happen, listening to Laura, to Karen, to the background information. Wow, that's really impressive. And then it's the delivery system, you know, that Cindy's involved in. You know, it just seems to me like, as you were talking, Cindy, that personal fulfillment that you get in this. I mean, and again, how all this reflects on Blessing as an institution, and then the real beneficiary of all of this is the patient. So it's like a lovely integrated system.
Thank you for joining us for Research Perch. Stay tuned for part 2 of our discussion about the massage therapy program at Blessing Hospital. Subscribe to us on YouTube to receive a notification when new episodes of Research Perch are released. If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.